The White House expects the U.S. will reach a new milestone when it comes to vaccinations today, with 50% of adults now fully vaccinated. That means nearly 131 million people have been inoculated against COVID-19. You may remember earlier this month, President Biden said that he wanted 160 million U.S. adults being vaccinated by July 4th. So it seems like we are on pace to surpass that. Joining us now to talk about it is Dr. Susannah Hills, pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center. Dr. Hills, thank you for being with us. So this is certainly encouraging news, right? 50% of the U.S. population vaccinated against COVID-19 today, but we know the pace of vaccinations has slowed considerably. So if we were to hang out at around this percentage, would we reach herd immunity?
The short answer to that is no, not really. At least we won't know whether we've reached herd immunity. The question is, the number of people who have some immunity from being sick are also part of that potentially immunized population, but we just don't know how much immune protection having had COVID gives us. So really, in order to feel comfortable that we have herd immunity, we need about 75 to 80% of the population fully vaccinated.
So, Dr. Hills, as Alexis was just mentioning, that pace of vaccinations has slowed down quite considerably. As we've seen some hesitancy really growing, I don't think some of the news around these vaccine boosters is helping matters too much. How can we get more folks to essentially go get those shots in the arms? Is there any messaging that you think needs to be happening or coming from the administration or from public policy or health officials, I should say?
I think now that we have this new opportunity for younger people to be getting vaccinated, we should really take advantage of that. It's the perfect moment right now to be talking about getting kids vaccinated, because states are also making their plans for school reentry in the fall. So right now we've got emergency use authorization for Pfizer for kids who are 12 to 16 to get vaccinated. I know a lot of families are eager to do that, but the more we talk and encourage parents to consider getting their kids vaccinated, the better off we'll be in the fall. We have to sort of think also now about next year and the next school year. And now we also have the Moderna vaccine, which is on its way to applying for emergency use authorization and getting approval potentially in the next month or so to also be usable in kids 12 and up. So that'll be another vaccine that's available, the Moderna vaccine, and now the Pfizer vaccine, being that this week we just heard the announcement that it's able to be stored at slightly higher temperatures. Both of these vaccines may be more readily accessible in pediatricians' offices. So going to get children vaccinated, I think, is an area where we could push and gain some ground, because kids are 20% of our population. We're not going to reach herd immunity without vaccinating them, and we're not going to have a safe school year without getting most kids vaccinated.
Yeah, that's an excellent point you make. I know even my kid's pediatrician said they hope to be able to get the vaccine at some point, which would hopefully make it easier for people to be able to go and get these shots for their children. Moderna also saying that its COVID vaccine is 100% effective in teens. But I'm wondering if you could sort of quell some of the concerns out there amongst parents about long-term effects of getting something like this vaccine, because there hasn't been a lot of data. I mean, we just haven't had a lot of time, right? Time's not on our side here, so not a lot of time to test this. And there are things out there saying that perhaps the vaccines will cause our children to become infertile. I mean, there are a whole bunch of different things out there. Can you speak to any of it?
Yes. So we have now had millions of people who've received these vaccines, and we have a really good handle on the side effects that we expect to see. The side effects we see with an mRNA vaccine, we expect to see within the first few weeks after getting the vaccine. And so these are short-term effects. They're mild headache, generally mild headache, malaise, feeling a little bit unwell, maybe some joint aches and pains. These are the things that we're seeing. The other more severe side effects are incredibly, incredibly rare. We heard about some cases of thrombosis and cerebrovascular thrombosis, and that is a concern, but incredibly, incredibly rare. So really, we're seeing minimal side effects, and the side effects in kids, in the adolescents that have been tested in the studies, are very similar to adults. super low side effects, minimal. We have absolutely no evidence or reason to think that this vaccine will have any effect on fertility. We have no reason to believe it will have long-term effects. And remember, these mRNA vaccines are new to us now in this moment with COVID-19, but the research on these vaccines has been going on for over a decade. So this isn't new technology. This is technology that has been worked on for years, many years. So it's well developed, it's well understood, and these mRNA vaccine particles are not durable. They're not going to last in the system for an extended period to cause side effects years, many months later. We're really looking for what happens in the first few weeks after the vaccine, and we have a really good handle on the kinds of side effects we're seeing, and they really have been very mild.
Good information, important reminders for us all, and should be part of the overall messaging going out from doctors and from the Biden administration. Dr. Susannah Hills, thanks so much for being with us today.